Bariatric surgery is becoming more popular abroad, and people are turning to it because it's very expensive here if insurance doesn't cover it.
That's why we talk about it a lot on the show here, because I guarantee there's someone out there that people know that are weighing these risks.
If it sounds too good to be true, it probably is. What are you going to do when you get back? What are you going to do if you have complications?
With a little health and a little wealth and a lot of love, that's the life that we live. Suits and scrubs.
Hello, everybody! Welcome to another episode of Suits and Scrubs. This is season 4?
I don't even know what season it is.
Season 4!
Seasons go by really fast.
Yes, they do. Yes,
apparently.
They do. Although we haven't done this in a while. Anyway, Suits and Scrubs, we're talking about a little bit of health.
A little bit of wealth.
And a lot of love. Join me as my co-host, who's double board certified in internal and obesity medicine. She's also exploring her functional medicine. Fun fact about her is she's going to drop this because we're doing our 30-day challenge. You guys know we do 30-day challenges, so it marks the new season, and we pick 1 through 6, I believe. Mm-hmm. 6 options. Eventually, we'll ask you guys to vote. 6. Mm-hmm. So you guys can't see this, but on the screen behind us, there's 6 different options that it lands on. We have to do that for 30 days. So the last 30 days, we did IVF, we did acromantia,
the treadmill or walking pads.
Yeah. And so we'll talk more about that in a second. Emmy!
Thank you, honey. My co-host here, Mr. Zachary SVP, he is our finance guru. He has managed over $1 billion to date, has reached his Coast Fire number. And fun fact about him is that he just got back from Japan and was probably the tallest person there the entire time.
Yes, I was. But you know what's crazy about Japan culture? They actually don't. They're very respectful and very, like, it's very much part of their culture. Mm-hmm. Like, no one really stare. Like, I feel like some people wanted to, but no one really stare because it's really, really rude. Lots of rules, though, over there. That's one thing I was, like,
I'm sure you stuck out like a sore thumb over there.
But I didn't, though. Like, some countries I go to, and I feel like I really stick out. But this one, I just didn't feel like I stuck out because the people did not make me feel awkward. You know, and everyone's very, very nice. The culture is probably my favorite country of all time. I've been to 40 plus. And so I went with my friend Russ. If you're watching, shout out to you. His new nickname is Bushi Bushi, which means samurai, because he bought a whole samurai sword. Whole nother thing. So with the 30-day challenge, Emily's going to drop this, and we're going to see what we're going to do for the next 30 days and report out on it on the show.
All right. Are you ready?
I'm ready. All right, we got 2. What is 2? Drum roll. Oh, you've been dreading this one. So Emily is going to manage our financial budget for 30 days.
Have I been dreading this, or have you been dreading this? That is
You've been dreading this. That's Excel spreadsheets. That's the whole works, dear. You got to do it all. And you got to be on me. Like, you can't spend $100 on the grocery store, like whatever our budgets are. And pay all of our bills. Oh, this is gonna be fun.
It's gonna be fun for both of us.
Yeah, not really. I'll walk you through like what we got to do or whatever, and we'll report out on that.
That clothing and makeup budget just went up a little bit.
Oh, did it? No, we have to stay within our guidelines. Zero-based budget. The title of this episode is "Should You Consider Bariatric Surgery?" So, guys, we're going to talk about weight loss is so hot right now. We talked about Ozempic, a lot of weight loss specials. Oprah's weight loss special just dropped not that long ago. And so weight loss is really big in America because obesity is almost, what is it, a pandemic? Epidemic? What's the word?
I would say it's an epidemic. In the U.S., yeah.
Yeah, and like epidemic and pandemic, do we know the differences? I don't know.
Epi is more localized,
okay.
Pan is...
There we go. See, that's why y'all are watching the show, not because my
just
dummy.
like COVID reached all corners of the earth. It's a pandemic.
Okay. So we are going to talk about the costs, the risks involved, and then maybe there's an alternative. You know, if folks are interested in exploring more extreme, right? I would say this is a more extreme way to get to the weight loss. I would say that, but I'll let you kind of cover that off on that.
Saying surgery is more extreme.
Yeah. Saying very, very much more
people
extreme.
perceive it that way, yeah. For sure.
If you guys have not caught our Ozempic face video, it's definitely trending on YouTube, which is really exciting for us. Check it out. In fact, we might drop it here. So, okay, cool. Our first segment is refactions. Refactions.
The CDC says weight loss surgeries are now part of a worldwide multi-billion-dollar medical tourism industry that is expected to grow substantially in the next 5 to 10 years. Our guests say that while the weight did come off, there were unexpected and devastating consequences. Watch.
My weight problems started in high school.
I've struggled with my weight for kind of all my life.
I got up to almost 300 pounds.
I tried a bunch of different things to lose it, and it was a constant battle.
My stepmom Liz had come back from surgery. She lost all the weight, and I saw that, and I'm like, I want to be thin again.
There's no way I could afford the options in the States. I'm a single mom with 2 kids.
I saw it as the magic bullet.
First thing that I can remember coming out of surgery, that I was in horrible, horrible pain, and all of a sudden I felt something wet on my stomach, and I looked down and I was bleeding from my stomach. I literally never thought I was going to get home to see my son and my mom ever again.
Let's react to that and fact check it. So it sounded like to me she went abroad. I don't know if that was clearly explained, to get this bariatric surgery. So
Yeah, so this, Megyn Kelly was talking about how it's become kind of a tourism. You know, people will go to these other countries and they'll put them up in resorts or hotels, and they'll have the surgery, and then they'll get, you know, the 2-week stay at the hotel or at this resort will be included in the cost of their surgery, and then afterwards they'll send them back to the U.S. with very little post-op care and post-op instructions.
they'll fly on the plane without having the post-op care.
So
Jeez.
it's, and I saw this in primary care for other surgical procedures, but bariatric surgery is becoming more popular abroad, and people are turning to it because it's very expensive here if insurance doesn't cover it. And so some people get desperate and they travel down to Mexico, and they don't really have the opportunity to vet out a surgeon down there, and they end up getting the procedure and they don't really know what they're getting themselves into. And then they don't know what they're supposed to do after the procedure. I think they're under the thought process that they're going to be given all of these post-op instructions, and then they get back to the U.S. and surgeons in the U.S. are afraid to see them or afraid to touch them because they don't really know what was done. And there could be complications if they go back in and repeat the surgery. So there are a lot of implications there. It's dangerous, and you have no follow-up.
Yeah, and the thing is, you said you have experience in this, so it may not relate to the bariatric surgery, but what surgery have you seen, obviously not disclosing names, that you was like, wow, this is done internationally, it was come over here, and just it was a nightmare?
I think plastic surgery is the big one. All sorts of different types of plastic surgery can be done abroad because it's much cheaper, much more affordable.
And you've seen that firsthand, right?
Mm-hmm. And the complications of it.
Wow. So I guess your overall decision on that is what? Don't do it. Don't go international for surgery. You may pay less now, but you pay way more later.
And not just saying international, because there are surgeons in other countries that are reputable surgeons. I'm just saying don't follow one of these gimmicks. Do your research. Don't follow one of these gimmicks to go somewhere specifically because it's a lot cheaper, and you're being sold kind of a bill of goods that you're going to have this wonderful experience and wonderful surgery, and it's going to be more like a vacation for you, when you really need to go into it knowing what you're getting yourself into.
Yeah, absolutely. When she said something was placed on her stomach, like I didn't watch the whole video.
She said she woke up and she felt just wetness on her stomach, and she looked down and she was just bleeding everywhere. She just had blood everywhere.
Oh, jeez. Well, thankfully she looked okay in the interview, so hopefully.
Well, she was saying all three of these people lost the weight, but at what cost?
Right. All right. So the next segment actually ties very, very well with this one. Under the microscope.
Under the microscope.
Under the microscope.
So we are kind of carrying on that last conversation into the data behind the cost of bariatric surgery. And so I just wrote down the kind of the average costs in the US and in Mexico, because I think they went to Tijuana. I think that's where she said she got it done. And so the average cost of gastric sleeve in the U.S. is about $19,000. And the average cost of a gastric sleeve in Mexico is about $4,500. I think they said $4,500 to $6,000. And then for the gastric bypass surgery, which is a little bit more extensive, in the U.S., average cost is $23,000, and average cost in Mexico is $6,000.
Gotcha.
So you can see why some people who are desperate and can't get insurance coverage will turn to
the cost
to this option. Yeah.
Yeah, and so you say a bypass sleeve and then gastric sleeve, and gastric bypass. What's the difference between those two?
So I would say right now they are probably the two most common bariatric surgeries in the U.S. And so the gastric sleeve has gained a lot of popularity. The gastric sleeve basically they just kind of sew up they take part of your stomach away.
Right.
And so they're not rerouting anything. They're just taking away a portion of your stomach. And that allows to decrease the amount that you're eating. You know, when you eat more food, it makes you feel full. You don't want to eat large quantities of food, but it also, there's a hormonal method there too, where we talked about ghrelin. You love
ghrelin. And what I know about ghrelin is ghrelin's in the stomach.
Mm-hmm. Ow! It's produced in the stomach, and it is your hunger hormone, so it makes you hungry.
And so guys, if you have not watched, we did a whole episode of hormones, and we broke these down. And how we kind of do things here at Suits and Scrubs is we kind of play on each other, right? So we introduced a topic, and now we're getting more advanced topics. So all these things kind of playing together. So if you want to learn more about that, check out that episode for sure.
Yeah, that was one of our just recent episodes.
Yeah, and it's like Hansel and Gretel is what I was thinking. You know how they ate the little house and the little witch in the house? And whatever. Anyway, so you were talking about that stomach hormone.
So by removing a large portion of the stomach, you are also removing the amount of ghrelin that is produced. And so not only is it mechanical, so it's just you don't have the space to occupy the food, it also is hormonal. And so that's it. It works in both of those ways to help people lose weight. Whereas the gastric bypass is a little bit more extensive. You're actually taking part of the intestine that's kind of lower down and putting it at the front of the stomach, so that you're bypassing the stomach and you're bypassing part of the small intestines. And
so that way your body doesn't absorb the nutrients? Is that why? Or the fats and things like that?
It is, you're definitely more prone to malabsorption. So you're not absorbing the calories. There are also some hormonal implications there, but I won't get into all of the details. But those are the two most common types of bariatric surgery, and they do them both in Tijuana, apparently.
Gotcha. I did not know that. See, my brother was stationed in California, and they went to Tijuana quite a bit. And so what I know about Tijuana is definitely a good time. I'm not sure it's a good time to get surgery. So no offense. You may actually be, if you are watching in Mexico, you actually might be a great surgeon. Don't want to knock you, but I guess the message is do your research, and now we know the difference between the sleeve and then the bypass.
Mm-hmm. Yeah, yep, gastric sleeve and gastric bypass. Okay. And there are a lot of other details that would make you decide to do one or the other. The gastric sleeve, as it probably sounds, is a little bit more straightforward and simple. And so the time of surgery is usually not as long. So you're under anesthesia for less amount of time. The surgery isn't as complicated. And so it's a good option for people who might have a lot of other medical problems where they're an anesthesia risk, or you don't want to keep them under anesthesia for too long. You want to get in and get out. And that's what we see with, especially with severe cases of obesity. People have all of those end stage issues or comorbidities that makes them a higher risk for comorbidities, which would mean other health conditions.
Defined. Say it again.
Other health issues. They have lots of other health issues.
Say that word again.
Comorbidities.
Comorbidities. Who comes up with these words? Can you put it in a sentence? Could you spell it? So tell me again.
Comorbidities.
Comorbidities. So that's just all the different other health issues.
Other health, yes.
And anesthesia, though, from my understanding, it's pretty invasive, especially for someone with comorbidities.
Well, you're
and overweight, I would imagine.
Under general anesthesia, you are putting people on sedating medications that can potentially lower blood pressure.
Right.
you're also putting people temporarily on a breathing machine and breathing for them if it's a more extensive surgery. But there are definitely complications involved for people who have heart disease, lung disease, especially if they have obesity, something called obesity hypoventilation syndrome, where they have so much weight that they're not able to breathe on their own. And so there are a lot of complications that can happen. I would say most of the bariatric surgeons in the US their percentage of complications are minimal when it comes to those severe complications, but those are just things that you want to think about. I know we kind of went down a rabbit hole, and we'll talk about it more later in the episode, but the gastric sleeve is more popular because it takes less time. It's more straightforward. So you would do that in people who might be a little bit more complex. The gastric bypass is better for diabetic patients. It can actually help manage blood sugar better and can reverse diabetes in a lot of people.
Yeah, and it sounds like to me, if you had the option and the cost was a factor, looks like the sleeve is actually a lot cheaper.
Yeah, it's
like $4,000, $5,000.
It's an option for
cheaper.
some people, but not all people, and some people require revisions. So we watch our fair share of reality television. We see people who have had some sort of bariatric surgery before,
like
and
My 1,000-Pound Life. Shout out to Dr. Now. I don't know if Dr. Now's still living. I mean that mean, but he's 80, 90 years old, and that man will go in there in that room and tell them, like, you're not eating the calories, you're making up excuse. He didn't play around, but he listened to him, but he did not play around.
He didn't.
Thank you, Dr. Now.
I don't know if he had the best bedside manner. He definitely was a tough love kind of guy.
Romanian, yeah, something. If you guys know what his nationality is and you're listening, drop in the comments. I would love to hear what that is. All right, so we talked about a little bit about bariatric surgery. Like, what is bariatric surgery? So do you want to get into a little bit more detail there? Because I know we kind of talked a little bit about both under the microscope. Because I just didn't know. I didn't want people to have like sleeve and then whatever.
Yeah, I mean, there are some other variations that are becoming more popular, but most people, I would say, at least until recently, I would say most people will choose one of those two routes. And if it's not an end all be all. Just because you have bariatric surgery doesn't mean that you can't gain all the weight back.
Right.
And so there's a lot involved in that, but there are certain things that if you can have revision. So if you have one surgery, you can have another surgery, but you're kind of limited once you've already had one and what they're able to do next. So you have to think about that too. But there are a lot of different options out there, and surgeons will certainly help to guide you in the right direction and help you figure out which option is best for you if you decide to go that route.
So what's the risks and benefits with each individual one? So let's just go through that. I know you touched on that, but let's just get into the nitty-gritty.
Yeah, and I feel like it's one of those like pharmaceutical commercials where they talk about all the things that could go wrong, and it makes everybody afraid to do it or afraid to take the medication.
That's a good point. You know what we should do though afterwards? And maybe we talk about like what's the risk of not doing it, right?
Yeah.
So talk about the risk of just going through it.
Yeah, so the risks would be more, and there are some short-term and long-term. And so ulcers can form, especially at the areas where if you're sticking things together, suturing things together.
Mm-hmm.
And
It sounds so painful.
Especially in gastric bypass. I mean, honestly, your gut doesn't really feel pain. The pain receptors that it has are more. What did I say?
It was gut. I didn't think you were gonna say gut. I think you were gonna say
How was
stomach.
I not gonna say gut during
I don't know. I thought you were gonna say
bariatric
stomach
surgery?
all the time. Well, anyway, so the word that you can't say was gut, and you said it. So go ahead and spill the word of punishment.
For those of you who are new to our show, Zach likes to play dirty and specifically chooses words that he knows I'm going to say during the episode. All right. We've got too many little doodads and things over
Gimmicks
here.
and
Gimmicks ready.
Obviously, I'm the one that does the gimmicks, while Emily. But no, guys, I want to make health and wealth fun. Like, it doesn't have to be just a.
I'm just getting tired.
Something's wrong with that wheel. Put it on the ground.
Oh,
Ooh.
it's still going.
Something's wrong with that
Is there a
thing.
magnet in there?
Nah, it shouldn't be doing that. We got to tighten it. Oh, no.
Oh. Which one?
So guys, it catered between pie in the face. Sorry, I just dropped my phone. No, that was a mouse. The pie in the face and Songbird, and it landed on Songbird. So next episode, you have to sing 60 seconds of a song.
Is it 60 seconds now? I thought it was 30 seconds.
Well, I changed the rules. Yeah, okay, 30 seconds. Okay, cool. So you were talking about the risks associated. So we talked about ulcers in the gut. So that's the word of the day.
And for that reason, people are not supposed to take NSAIDs like ibuprofen, naproxen, because that can also cause gastritis and increase your risk of ulcers. So you have to keep that in mind. There are the nutritional deficiencies that you can see with, and that's seen more with bypass. So you have to make sure you're taking your bariatric supplements after surgery. There is something.
What's the kind of supplements that they take?
Usually there is a list of different vitamins.
Gotcha. Okay.
Vitamins and minerals that you can potentially become deficient in, either from decreased stomach absorption or when you're bypassing the parts of the small intestine. That's where you're able to absorb a lot of different minerals and nutrients. And so you have to make sure that you're still getting all of those essential nutrients. The other thing with the sleeve specifically is potential worsening GERD, which is reflux. So heartburn, acid reflux can be a little bit worse after gastric sleeve. The gastric reflux can actually be better with weight loss. So that's something else to consider. And then just the post-surgical complications, being in the recovery bed for a long period of time, risk of clots like DVTs and pulmonary embolism.
Which means like it's better to walk around or whatever. And pulmonary, what was that word? Pulmonary
embolism
I've
is,
heard you say that
it's a
before.
clot.
It's a clot, yeah.
Clots typically start in the vessels of the legs, and then they can go up and travel and go to the lungs. And that's probably one of the most serious complications that you really have to keep an eye on.
Right, because if it hits the lungs, then it's game over, right?
Not necessarily. It's definitely more serious, but if it's a big enough clot, then it certainly can be disastrous.
Gotcha.
And then hernias, anytime you have abdominal surgery, you're more prone to having hernias, gallstones, or having issues with your gallbladder. If you lose weight rapidly, you're just more prone to having issues with your gallbladder. And so sometimes they'll actually remove your gallbladder while you're having the bariatric surgery.
Does your gallbladder serve any purpose, honestly?
It's a kind of a storage reservoir. So it helps to store what you need to digest fat. And anyone who's had their gallbladder out might realize that if they eat a high-fat meal or a lot of high-fat meals, they don't have as much of the bile stored to be able to break that down. And so they'll have a lot of diarrhea and loose stools.
Oh, wow. Okay.
Kind of chronically.
Did not know that. I did not know the gallbladder. Okay. So I was today years old, and it's 10:18 Charlotte, North Carolina, my time. So drop a line in the comments where you are and what date when you learned about what the gallbladder is. That's fascinating to me. Sorry. That was a nugget moment for me.
You don't have to have it. It's something, I would say it's not as useless as the appendix, but
This is how I feel about that. If I'm born with it and it's in me and attached to me, I don't want to like cut it out or remove it. I'm just saying, and that's just me.
yeah, it's got to have some purpose. It might be a small purpose, but
Yeah.
it's still there for a reason.
Yes. All right. So we talked about all of the risks associated. Like, what is the risks of people not having the surgery if this is an option that they're really looking at? Or another way of saying that, what are the benefits of this surgery that affords them? Like, this is a pretty, you're cutting into your stomach and all the other stuff. I'm just being real, right? Like, there's obviously some people who do this have to have it for some. The benefits have to outweigh the risks. So shoot.
Yeah, and something I did mention when we talked about what bariatric surgery was, now a lot of times they're able to do a lot laparoscopically. And so that means that instead of cutting into your stomach and causing a huge incision, then they do little tiny cuts, little tiny incisions, and they have equipment that's able to get in there through these tiny incisions.
Now, modern medicine, man, that is awesome. That's pretty cool.
So it's not as scary as some people think it might be. I know it's still a surgery, still a major surgery, but you're not going to end up with a huge scar down the middle of your stomach.
Right. That's good. So good cosmetics.
But benefits. The benefits are the benefits that you would see with extensive weight loss. So you're going to see, and some of this too, it's not just the weight loss, it's the surgery in and of itself because of the hormonal implications or the hormonal effects of the surgery, but you're going to see improving blood sugar. A lot of people are able to reverse their diabetes or at least significantly improve it to be able to stop taking insulin or a lot of their medications. You're lowering your cholesterol, you're decreasing fatty liver, so decreasing the fat deposits in your liver, which, by the way, cirrhosis now, so end-stage liver disease, a lot of people tie that to alcoholism and drinking alcohol, but we're seeing a lot more cirrhosis in people who are obese just because of fatty liver disease.
Because I'm taking a sip of alcohol
because
now.
it progresses to an end-stage liver disease.
What's that called again?
Fatty liver disease.
Fatty liver disease.
Yeah.
And what was the technical term for that?
So non-alcoholic steatohepatitis or hepatitis is the mouthful. NASH. A lot of times we'll call it NASH.
NASH. I've heard of that before.
Mm-hmm. And then OSA, sleep apnea. So it can reverse sleep apnea. You can come off of blood pressure medication, so it can improve your blood pressure and all of the downstream effects of being able to be a healthy weight. So your functional status, people are able to move around better. They're able to exercise. They're able to play with their kids. They're able to work a job that they didn't think they would be able to work before. They don't have they might still have arthritis, but not as bad. A lot of people notice that the knee pain, especially, arthritis of the knees is tied to weight. And so there are so many benefits, I think, that if it's a last resort, if you feel like you get to the point where nothing else has worked and you're a candidate for this, especially if insurance pays for it, I think you should really think about it.
Right. You should definitely weigh the different risks or whatever.
Yeah.
And I know we talked about this in the episode in the beginning, which we're not there yet, but just to tease you guys, there could be another option. And so we will look into that in just a moment, right?
Yeah.
Now, this may be later in the episode, so just tell me to stop and we'll move on to the next question. But the question I have is, once you get this surgery, is there some sort of plateau effect that happens? Or do we talk about that later? And should I hold that question then?
No.
Okay.
And it's there is a plateau. You can expect to lose 2 to 4 pounds a week initially for the first several months, and then the weight loss will start to definitely decrease over time, and to the point I want to say a year and a half post-op is when you probably reach your plateau.
Gotcha. So a year and a half. Gotcha. Because I remember watching these 1,000-pound life, Dr. Now, 1,000-pound sisters, and they say like the first few months you just go at it, because it's going to pull weight off of you, and then 6 months, but then you will not have that same effect if you weighed out. So, some people weren't hitting their goal weight, and they're, and they had like different goals or whatever, and they weren't hitting that. And the doctor was saying, listen, like, this is the prime time to do it. You went through all that, all the pre-op stuff, which you have to you do psychology and a lot of things you got to do prior to, right? Now, you fact check me if reality television is not right, but that, No,
but I would say those shows, because they also, the surgeon is also part of the show. And so you see a little bit behind the scenes there too. But a lot of times, if you're not on track, if you're not losing the weight at the speed that you're supposed to be losing it, it typically means that there's some lifestyle stuff going on that maybe you're not following the recommendations.
Right. And I just want to pause to tell a story. So I know probably people are like, well, why are we covering these topics? Well, for me, and why do I watch these shows? Well, oh man, this is kind of hard to talk about. So when we were growing up and we didn't have a place to stay, one of my mom's friends named Janice, took us in, and she was very overweight, and she actually died in her sleep at 40. And I remember my mom calling me and telling me, and I was just kind of lost it at work. I mean, she's just been with us since I could barely remember. You know, I can't remember life without her. She's my mom's best friend. Mm-hmm. And so I just think that I couldn't save her. I couldn't help her. So as I got older, I just had almost an obsession with 1,000-Pound Life, not for other reasons why people watch it, but for me, it's just like I couldn't save her, but this is how, like, I just wanted to learn more about it. And so that's why we talk about it a lot on the show here, because I guarantee there's someone out there that people know that are weighing these risks. And this is a real life example. This is why I'm so like adamant about sharing these kind of stories. So
I think it's heartwarming to see people who are able to overcome that, because it's such a hard thing to overcome.
It is.
We talk about addiction and we talk about it all the time, but that's something, and we've had conversations ourselves where we say, you know, that's a lot of times an addiction that you wear on your sleeves that you can't hide from people.
Can't hide that.
And
because if I had my addiction out there for the world, I don't know if I would be as like what my outer appearance would be, you know. And I don't want people to get confused, because I am a big fan of the body positivity movement, and I do believe that health is not judged based upon someone's size. Like, someone may have PCOS, someone may have, you know, other things, but they may be healthier than someone who's skinny, you know. And I think society's normed on that, which is not what this episode's about. But I just want to take a moment to kind of share that story, because I just, you know, there's a lot of good information, but I think it's important to kind of talk about things like that.
I know it's a near and dear topic to your heart, and it's something that we enjoy watching that, to see people overcome their problems. We also like to watch a lot of the Chris Klein, or Chris Pine, I can't remember his last name.
Yeah.
But we like to see people's journey and see them overcome things that
like
overcome obstacles.
And all that. And again, it's not weight on the scale. You know, we want people to be a healthy version of them. In fact, I had this whole debate with someone that's part of the body positivity movement, and I let them know, like, listen, it's not a weight thing. It's more about the healthier version of you. And so it was a healthy debate, and I really respected where they came from, and they respected where I came. It was very, you know, kosher. So okay, so the next question I have is what factors do you consider before you recommend this to your patients?
So you'd mentioned earlier, surgery it's not something to take lightly, and so I think you shouldn't go into it without trying other avenues first. I think someone who has a lot of weight to lose and is having a hard time, because sometimes you get to the point where you have your ability to exercise, or your ability to follow the lifestyle is a little bit harder, because you have more of the comorbidities or complications from obesity. And so you have really bad arthritis, or you're debilitated because of breathing issues, or your diabetes. And so if you've tried all other things, especially if we're having a hard time managing diabetes, because some people will be on insulin and 3 different diabetic medications, and we're still having a hard time getting the diabetes under control. And so bariatric surgery can be a very effective way to stop the progression of the diabetes, because that in and of itself causes issues with your vision and your kidneys and your nerves, among other things. And so I think it shouldn't be the first option. It should be something if there's not another option.
Gotcha.
That's my personal opinion.
Okay. And then, no, I think that's good to share your personal opinion, especially since you do have a lot of experience in this. I mean, you're BC certified, right? BC medicine certified, but you have a lot of experience working with patients to help them lose weight, but not just for vanity purposes, but being a healthier version of themselves. And so I think things to talk about is like support systems and all that stuff there too, because even if you do all the work before surgery and then after surgery, if you go back to the same habits, you're just going to go back and gain all the weight back.
Yeah, and you'd mentioned this too, just from watching the show. You see that they go through a very strenuous process beforehand.
100%.
And so they have to have the psychiatric evaluation. They have to show that they can be compliant. They can meet all of they can show up to all of their appointments, because you need to see the nutritionist, the dietitian. You need to have an understanding of what life is going to look like after surgery. And I think they do a good job of that now, of really putting people through a very stringent process in the beginning to make sure that they know what they're getting into, and they're going to be able to follow the recommendations after surgery.
Yeah, absolutely. I think that makes sense for sure. So we talk about health and wealth in the show, so let's tie in a little bit of the financial aspects of this. So let's talk about insurance coverage. Like, how difficult is it for insurance to cover this? Let me hold my thoughts. Yeah, so how difficult?
You definitely have to meet certain parameters before they'll be even willing to cover for certain insurance companies. I think they know the long-term benefits of the weight loss associated with bariatric surgery and the improved outcomes with diabetes and all of these other medical conditions that I think more and more insurance companies are starting to cover. But you do have to jump through a lot of hoops, and typically you have to show that you're going through a six month, I think some of them will say a 6-month weight management plan, where you're seeing a weight management specialist regularly, either on a weekly basis or at least on a monthly basis. I know I had patients that were seeing me even in primary care office who had to make sure that they were meeting those guidelines in order to be eligible, in order for insurance to eventually pay for their surgery.
Right.
And so there are a lot of hoops that you have to jump through.
Right. And I feel like there's a lot of upfront costs. And man, this is a whole debate online right now about obesity being a disease, right? And so I do think addiction is a disease of the mind. And I'm not saying all cases of obesity is going through that addiction process, but I do think that in some cases where, yes, it is, it's a comfort thing, it's emotional eating and things of that nature. And I do think that as we explore that a little bit, it's a challenge, because if you do want to get help and nothing else is working, and this is something that's been recommended, you do all the things right, and then insurance, I just feel like the insurance, like, it's going to cost more later. Like, if something happens or a complication, where I feel like, it's so challenging. Insurance, it's challenging, right?
Yeah.
I do think there's some boundaries and parameters in place with insurance, but I think in some cases like this, it makes it hard for the patient.
Yeah, I think from a surgical perspective, it makes sense to me why insurances are a little bit more strict with guidelines. I think some of it is overkill, and some bariatric specialists will say they make people wait too long, that they should be offered, especially if they meet certain numbers, they should be offered this option from the beginning, because it'll help them lose the most weight, lose it, before they have the long-term issues, instead of making them wait 6 months or 12 months of doing doing just lifestyle interventions. I understand the point of that too, but I think it makes sense. What doesn't make sense to me so much is of insurance companies not covering medications that can help with weight loss, where you're not having the post-op risks.
Right.
I think that is what really irritates me, and which
I think we'll talk about it.
grinds my gears.
Grinds your gears over here, Emily MD. Okay. So now we talked about the cost in the beginning. I think you answered this already, but let's just dive deeper into this. So someone is really faced with challenges, insurance is not approving, and this is the option that their doctor recommends, that the option that they want to do. Do you recommend them leaving the country for this surgery?
I don't think it's a good idea. If you're going to one of these places that it sounds too good to be true. If it sounds too good to be true, it probably is. And we talked about this earlier, but what are you going to do when you get back? What are you going to do if you have complications? Because there's always that even if you have surgery in the US, there's always that chance that you're going to be one of those unlucky people who has some post-op complications, some issues related to the surgery. But at least if you're in the US, you have a surgeon that you can go back to. You can call their office who did the procedure and knows what everything looked like inside there and knows exactly what they did and knows what the complications or the risks were involved.
Right.
And it's documented in the electronic medical records in that hospital system that you went to. And you have, there are guidelines in place for if you have complications. But if you just go to a resort and stay there for 2 weeks, and yes, they might have nurses that are making sure that they're checking your wounds and giving you fluids or giving you pain medicines if you need pain medicine, and they send you on an airplane back home or however you get home, and then it's like they ghost you. Really, I've had patients where it's like I've tried to get a hold of them and I just can't get a hold of them anymore. They just won't respond to my emails. Geez. They won't respond to my phone calls. And what are you going to do anyway if it's a more urgent complication? You're not going to fly back to Mexico or wherever you got the procedure or Colombia.
It end up costing more. And the fact that you actually have a real life example of that, I mean, you have so many experiences, in your as you were taking care of patients. So
I've never seen it be worth it because I probably see the bad side of things because I have people coming to me complaining of the symptoms or the complications from those surgeries that they had abroad. And then I know how difficult it is to find a specialist, a surgical specialist or a surgeon to touch them because they're like, I don't want to go in there. I don't know what I'm looking at. But
their medical license on the line. And then, which is a really bad experience for both the patient and the doctor because it's like, I hate to relate it like this. Obviously, I'm double tatted up, right? And so I hate to say this on camera, but I actually had I had a sleeve. I wasn't that happy with it. I was happy enough with it, honestly. It wasn't their style, and I was really adamant about seeing this person. I wanted more intricate. If you know me, I like intricate stuff, right? And I went to tattoo artist after tattoo artist after tattoo artist, and most tattoo artists are like, no, I don't want to work on that. I don't want. I know it's not the same thing, but I'm trying to relate to it a little bit. But it's kind of like,
Yeah, and you also don't want to be like, I don't want them to think that I did this. I don't want to go in there and then if they have to have surgery again or if they go to another professional after me, say, oh, this doctor that they last saw completely messed them up and should be given malpractice, should be they should file for a malpractice suit. So I can understand from both sides, but that is a decision that I think you don't want to make.
Right. So Emily says, no, don't do it. So I'm looking into is this Laurie? Laurie, Betty, Karen. We named the cameras after our moms. So Laurie, I'm looking into Laurie. Don't do it, guys. Don't go to another country to get surgery. Especially, I'd never thought about the post or whatever. So guys, if you're staying to the end, this is probably why you stay the entire time. Is there an alternative option?
Yeah, so I'm a huge proponent of the GLP-1s, and I know we talked about Ozempic face and butt,
which is trending on YouTube.
The last episodes, and the Wegovy and Zepbound and all these new medications that are coming out. But honestly, the tirzepatide, which is the Mounjaro and Zepbound, and it's a double hormone mimic, so it mimics it's a GLP-1 analog and a GIP analog. So we're starting to see numbers that correlate with bariatric surgery. So people can expect to lose around 20% or 20+% of their initial body weight by this just being on this medication. And I think implementing lifestyle as well. But if you think about the numbers that you typically see in bariatric surgery, and it depends on your starting weight, and there are a lot of other factors that come into it, but to have a medication where you don't have to deal with the potential
that's the thing, though.
Surgical or post-op complications, if everyone had access to it, I think it's definitely a good alternative, and at least
your body naturally produces GL1, which we learned that in the last episode, right?
Yeah, these medications just basically have a very exaggerated effect of that hormone. So it exaggerates. It's not something that you would get just naturally from your GLP-1 hormone, but it definitely can give people some really good numbers, some really good weight loss numbers. And sometimes too, the other thing that we see, and we watch these shows where people, they aren't even candidates for bariatric surgery yet because they need to lose weight to even be able to be operated on. And so I think these medications also can be a bridge and can help people.
So let me get this straight. So you're saying that these GLP-1s are just as effective as gastric bypass?
I'm saying the numbers that we're seeing can definitely be similar.
That's such a doctor, right? I'm just kidding. No. But no, honestly, there's a beauty in that. So you're not going to say yes, but you're going to say that the numbers are looking really good.
Yes, and if you start off at a higher weight, you probably are going to lose more weight by doing bariatric surgery. If
If you have a higher weight, don't you have more comorbidities? What's that word again?
Yes, you do. But that being said, you probably, if you need to,
because you should be underneath. I'm sorry to interrupt you, but you should be underneath anesthesia if you're, I know really overweight people should not be on anesthesia or should not, right?
Yeah. So I mean, that's why they have safety parameters and protocols where they won't operate on. Many surgeons won't operate on people until they're able to, until they're able to show too that they're able to follow guidelines and they're able to start kind of changing their lifestyle. And so that's part of why they have surgical parameters too. But I think these medications can be helpful pre-op. I think if you
less invasive,
if you have somebody who's really motivated and wants to change their lifestyle and they want to use this medication, they can get, there are plenty of people who have lost 80, 100 pounds.
Wow.
By
these medications.
By these medications and lifestyle and implementing some lifestyle changes.
Yeah.
But
if you want to learn more about that, then just go and watch the other episode, or you can go to SusanScruggsPodcast.com. Emily has a 7-day meal plan that resets your cravings. We're kind of crunchy over here a little bit. We're moving. We did sunbathe today. Did we do it once? Did we ground today?
I don't know. You grounded today. I did ground today.
You did not ground. We have a geriatric cat named Ollie, and so she has dementia.
Outside.
Yeah, so we take her outside for her senior living outside time.
Or sun time.
Yeah, sun time. All right, guys. So I think it's another episode. Thank you for walking through all that. Anything you want to say before we close?
No.
Don't go to Mexico.
Well, go to Mexico, but don't go for the sole reason of getting a surgery unless you've done your research.
There you go. All right, guys. That's another episode. A little health,
a little wealth, and a lot of
love. Until next time. Bye, guys.
Bye.
He's on the hustle, she's on the grind. There's no time to kill. We're saving lives and new deadlines, and there's some holes to fill. With a little health and a little wealth and a lot of love. That's a life that we live. Susan Scruggs.